Hi, everyone. It's 1 week post election, and I know everybody is feeling a range of emotions. There's excitement, there's distraught, there's scared, there's everything out there right now. Um, but my mentor always taught me to look for the opportunity in everything. And I've always kept that in mind going through life. I don't want to ever lose the opportunity in something just because I'm allowing myself to feel a certain way, no matter how justified or unjustified that may be. So, what I want to talk about 1 week post election is the focus on something that many of us have found very important, and that's prescription drugs. That is the FDA, that is healthcare. So, I had a meeting last week with a scientist at Virginia Commonwealth University. He is going to do my podcast. I'm very excited. But we had a long conversation about so much that we talk about on this podcast about how the FDA has been dropping the ball for years, how there's no transparency in healthcare at all, how the adverse reaction database is a complete mess and needs to be completely overhauled. We talked about how there's a lot of real estate between RFK Jr. and Dr. Fauci. So if we can get in there and try to have a good discussion and bring in different ideas, bring in different concerns, have a discussion. I know when I started talking about what happened to me with the drug reaction to Humira, when I started talking about how I had gotten worse after getting the COVID vaccine, everybody took it as this affront to science, and it wasn't. It was that there's just no transparency out there, and people are getting sick off of prescription drugs. There are reactions that we don't know about because we're just not putting them out there. There are things that happen to people with vaccine. I'm not anti vax at all. But you know what else? There were people who got illness from the COVID vaccine. So, I think that podcast, I think it's going to be great. We're going to be talking to Dr. Keith Ellis. He has really put a lot of emphasis on helping patients with long COVID, direct help, which is something we desperately need. And I think us in the Living Chronic Nation, we just need to take this moment and realize that it's a moment and we can make change. So let's stand up. Let's talk about the FDA. Let's talk about all that's wrong with it. Let's talk about all that's right with it. Let's talk about how we can make things better for patients. Because if we all just sit in our own little sideline and never have a discussion, we're just never going to make it better. And right now's our opportunity. Let's make it better.